All right, well, good evening, everyone. Welcome to our September IPHA Town Hall. And as always, we're really fortunate to have an expert with us tonight to talk about a very needed topic on vaccine hesitancy. And we're honored to be joined tonight by Dr. Kelly Gable, and she is professor at the Department of Pharmacy Practice at SIUE and the Director of Wellbeing and Resilience. And I will mute and let Kelly take us from here.
All right, excellent. Thank you, Garth. I'm really excited to be here, and I know that this is it's a timely conversation, and also I'm sure that folks have lots to contribute. I know we only have 30 minutes together, but I am certainly eager to hear your thoughts, your comments. And I know that this is it's not an easy conversation to have. So with that said, actually, I want to open up and make sure I've got my chat going here. So for folks that aren't as comfortable to unmute and just chat, feel free to type in the chat and hopefully we can get some good dialogue going. So a little bit of backstory for me. I am a pharmacist, for those who don't know me, and I teach at SIUE. I also work as a psychiatric pharmacist at an FQHC in St. Louis. And I also took the time to become a trainer for motivational interviewing, which is a process, and it is allowing me to be able to train our family medicine residents, our pharmacy students. And I really have a passion for motivational interviewing, and also recognize that not everybody does. So my hope is that as we engage in this conversation, there are things that you say, okay, all right, Kelly, I like that. And some things where you say, well, I've got some more questions, and that's all right. So here we go. We're going to talk about motivational interviewing in the world of vaccine hesitancy. I don't have any financial or conflicts of interest in this topic. We're going to talk about communication strategies, spirit and skill of MI, and it's going to be brief because we could talk about motivational interviewing all day and have workshops on this. So we're going to be brief, and then we're going to talk about the end of what we all, I think, desire, which is to build hope and trust and healing in our communities. Okay, so we're doing pre and post assessment questions because you get CE credit for this. So we'll start with question 1. When engaging in an MI-based conversation, the clinician should aim to embody what communication style? I don't know if we really need to, we'll say the answer at the end. I don't know if anybody wants to throw out your guesses in the chat. But is this a director, a guide, a follower, or a learner? An MI-based conversation. Folks are going with B. Yes, I see some folks that learned MI with me at some point. Right on. All right. Well, we'll see if you are correct. Lots of B's. Okay. Letting the patient know that the decision to receive a vaccine or not is always up to them is an example of partnership, acceptance, compassion, evocation. What do we think? This might be a little bit tougher. I see some A's. I see some B's. All right. Well, we shall discuss, and we will certainly talk a lot about this. Okay, here we go. So maybe if you could give me a thumbs up or raise your hand in with your icons, folks that have actually had some motivational interviewing training. Who in this virtual space has had some MI training? Just a handful. Okay. So what I'll say is there's so much more that we could talk about. Motivational interviewing it's a style, it's a communication style that we can embody. It takes practice, similar to learning how to play a musical instrument, learning a sport. So it's something that we understand the skill and then we practice. So just know that as we go through some of this. It is important out of the gate to say that motivational interviewing and sessions about vaccine hesitancy are not a way of tricking people into getting them to do what you want them to do. And I know that we all, most of us in this space have a desire for public health and wellness and a vaccinated community. But when we approach conversations, the goal is not to trick someone. We are not in the business of behaviorally manipulating someone. And that's really where MI is different than behavioral manipulation. It's also not a decisional balance. And sometimes we think about change making and we think, well, tell me all the reasons why you'd like to get the vaccine and tell me all the reasons why you don't want to get the vaccine. But what we know about making changes in our life is that if we get someone to talk about all the reasons why they don't want to change, they're less likely to change. We want to start to pull the conversation towards reasons why they might want to change. And I know that's not always easy, especially when someone feels pretty stuck in, I'm not going to get vaccinated. But that's our goal, is I want to listen for that change talk, and that's what I want to respond to. I want to pull that. So I don't want to do this balance. I don't want somebody to talk too much about not changing. And I want you to know these conversations are not always easy to navigate. And quite honestly, they're becoming more and more difficult. Even for folks that I would say would call themselves skilled, these are not easy conversations. And I can tell you, most definitely, they're not always going to go the way you want them to or lead to the change that you hope to see. But I always have hope that with each time I interact with someone and each time I engage them, there's a possibility that change is moving in, we're moving in that direction of change. Okay, so let's also put out there as we talk about these conversations, these challenging conversations, is that it's not MI if there's no ambivalence. So if somebody walks into the pharmacy and they say, hey, I think I'm finally ready to get my COVID vaccine, and you say, all right, well, let's do this. That's not MI. I mean, that's awesome, right? But that's not MI. MI is really when someone is truly back and forth, and they may not share the fourth part of it. They may just say, I'm not getting vaccinated, but there's a true ambivalence inside them that says, maybe I should, but I don't know. I can't. I'm scared. I don't understand this. There's something back and forth in their head. We all experience ambivalence about all kinds of things in our world: sleep, exercise, taking a medication. So right now, the focus is vaccine. The focus is vaccine hesitancy. So we want to recognize that ambivalence, in its simplest way, is not pathological, it's normal. We all experience it in the process of change. So we don't want to pathologize it. We don't want to say, what's wrong with this person? But we want to say, okay, all right, maybe they're thinking about change. I need to figure some more information out here. This is how we start to move someone towards a change process. Okay, so let's do this scenario. And I kind of like if we could do this. Trying to think of how we could do this. Maybe we'll type in the chat. What I want you to do is I want you to just naturally respond to this patient. So let's say you're having an education session, and let's take out the difficult part and say it's not a family member. It's not a close friend. This is a patient or someone that you are seeing in a healthcare setting. You're providing education about the COVID-19 vaccine, and they say, I won't get the vaccine. I've heard about people getting COVID after they get the shot. What is your initial response? Don't put too much thought into it. What are you going to say? You can feel free to unmute yourself and just say it, or just type in the chat.
I'd ask where they heard that from.
Okay. Yeah. So where did you hear that from? Yep. I think you'd get some interesting responses with that, right? It could be a friend, could be online, could be another doctor. What else we got? Let's talk more about your concern. Oh, you might, but it might be worse if you end up in the hospital. Okay. Yep. So that's where I want you to go with what your natural gut response would be. And I think a lot of folks, we're going to move to this place of, let me tell you why that's not right. Right? We all know that that's not accurate. Let me tell you why. But what we know about doing this is that we push someone, right? We naturally push someone, and we know what happens when we push someone with our words. They push back or they fall back. They push back and they argue, and they tell you, well, if you found that online, let me tell you what I found online. Or if they fall back, that means, cool, I'm not going to come back. Right? I'm not going to engage in this conversation with you anymore. And so what I want you to recognize is that if you fell into this place of, I need to tell you that it's not possible for you to get COVID when you get this vaccine, it's not a live virus, you're likely falling into this director role. I need you to know this. I need to tell you this information, right? If you found yourself thinking, I'm going to do a lot more listening, I'm not doing much talking in this conversation, maybe you're falling over here in this follower role. What I want you to think about in true MI fashion or conversation, I want you to try to be a guide. That was question one, right? And I think almost everybody said guide. That's where you want to try to put yourself as a guide. I need to listen. Tell me about your concerns. And so whoever put that in there, tell me a little bit more about that. I'd like to hear more about what you know about the COVID vaccine. And then we're going to get to a place where maybe I share a little bit of information as well. And that's the back and forth, the true back and forth conversation as a guide. Make sense? We could talk a lot more about that, but we'll keep rolling for right now in the interest of time. Okay, there are certainly roadblocks. These are established roadblocks to conversation. This means that if I throw out one of these roadblocks, the conversation's probably going to go awry or it's going to halt. Okay. Some of these are pretty standard and I think we all get it. If we threaten someone, if you don't do this, you might die. If you don't do this, you might go to the hospital. I think every single one of us, if we've ever said that to someone, we didn't likely get the response we hoped for. Right? We got reasons why maybe that's not going to happen. Or, yeah, I've seen other people who've been sick and they didn't go to the hospital. And so we're going to get pushback. So the warning and threatening is pretty straightforward. But some of these other things like giving advice, praising, or providing solutions, those are also roadblocks, as well as disagreeing or any kind of judgment, which we all can bring judgment to the table. All of these things are roadblocks. So here we go, another exercise. I'd like for you to tell me, I'm going to go through these one by one, which ones are roadblocks. So what if I told a patient, you should get this vaccine to better protect your family? I think we could all agree that's true. What is that though? If I said that to a patient, what do we think? Roadblock or not a roadblock? Yeah. We're kind of pushing, we're guilting, we are giving advice. You should really get this vaccine to better protect your family, but guilt is a huge one in there, right? And so I think you're capturing pretty quickly how that's a roadblock and how that's going to likely push that psychological reactance from that person to say, yeah, but let me tell you, my whole family's already had it. So we're good, right? We're going to we could get all kinds of things from that. Okay. It's a judgment as well. Yep. The best way to end this pandemic is for everyone to get vaccinated. What do we think about that? Roadblock or not roadblock? Yeah, I see preachy. Mm-hmm. Yeah, providing solutions. It's a director. Yeah, it's pressure. It's a director. How about you have too many health risks to not get vaccinated? Boy, let me tell you, I have a physician I work with and he is lovely. He is so kind and he likes to tell people this. You are too sick. You have too many health risks to not get vaccinated. Is that a roadblock? Yeah, for sure it is. For sure it is. It comes from probably a very great place, a very kind place, but it is certainly a roadblock. It's not going to lead to the change you hope to see. And so here we go with, let's lead off with an open question. Tell me about some concerns you have about the vaccine. Let me just listen. Let me hear what you're really thinking. And I want to listen at this point without judgment. Just let me understand. That's where I want you to be. However, helping professions, inevitably, nursing, pharmacy, physicians, NPs, we have this natural desire to want to tell people how to fix a problem, how to right a wrong. If somebody tells us something that's clearly wrong, it's so hard to not just jump in and say, no, you're wrong. Let me tell you why, or let me fix this for you. And what that does is it really pushes someone again into a corner. They often feel frustrated, they feel defensive, and we're seeing that right now at its finest. We're seeing people who are getting defensive. Maybe they feel powerless in their own care, and that is not where we want someone to go, is to a place of powerless. And so with that, let's do one more quick example before we roll into from what not to do to what we want to do. Does anybody want to role play with me and have a little fun with this? I saw Harry on the call. Do you want to join me, Harry?
If Harry can't do it, Laura will do it.
Yay.
I'm here.
Good. Okay.
Oh,
All
yeah.
right.
Except Harry, you do it.
All right. Are you ready,
Okay.
Harry?
Sure.
So what I'll do is I will play the clinician and you play the patient. So we're just going to role play what's on the screen. Okay.
Alrighty.
Okay. So here we go. So I'm going to pretend like we know each other a little bit. You're coming in to see me and I'm going to say, you don't want to get the COVID-19 vaccine, Harry?
Well, I'm not sure. I feel like I should get it. Everybody else is getting it, but it's just not very safe from what I've been hearing.
Yeah, I hear you, but there's really no reason to be worried about safety or efficacy. It's been put through clinical trials. It's FDA approved now. There's absolutely no reason to be worried. Let me tell you, even I got it. I'm ready in line for my booster.
I mean, I've done some research, and especially with it being the FDA pushing it through so fast, and everybody there's this whole group of people I saw online who had interactions. I don't think that the full picture is really there.
Mm-hmm. Well, I get it, but listen, I'm a pharmacist. I'm very familiar with the research. I know about vaccines. In fact, I recently, I read this peer-reviewed study. In fact, I'm happy to give it to you, and it shows you it's safe, it's effective. So, if you could just read this. I'm looking at the chat. So awesome job, Harry. Thank you for that. And so what I want you to see with that was that is not an uncommon conversation. That is 100% a director. What I was doing there was I was jumping in. I wasn't really listening. I was righting his wrong. And I continued to kind of discount what Harry had to say. And where that conversation is going to go is certainly not in the direction of change. And so what I ask you to do, if you find your conversations at times doing this, to just pause for a moment and say, how could I approach this differently? Is it worth it? Is it worth my time and their time to approach this differently? So let's pause, take a breath, and shift our focus. And let's talk about why someone might change. And then what are we going to do in our conversation to really move that towards change? Okay, so let's start by saying motivation is not something I'm giving to you. I cannot give that person in front of me the motivation to go get vaccinated. That is not how it works. The motivation lies within them. And I think you all know that. You get it at this point. That's why motivational interviewing is so valuable, because as the clinician, as the pharmacist, I'm here to figure out what that is and pull it out of you. And I'm going to do that by listening and responding to whatever that might be. Motivation certainly vacillates. We've all seen it. We've seen someone say, all right, I'm going to do it. And then they don't show up. And then each week that happens, right? It strengthens, though, when I feel like this is achievable. I can see this in my future. But it belongs to that person. It certainly does not belong to me. It doesn't belong to anybody else. It belongs to that person. Believe it or not, your style, your communication style, actually has more influence in motivation than one's own environment that they are in. So there's 4 pieces that I want to share about an Am I Consistent session, and we call it PACE. It's like keeping the pace steady: partnership, acceptance, compassion, evocation. All right, so these are the 4, and this is a part where I also would love to get a little bit of dialogue going with folks, so you can realistically see how this goes. Partnership is, I'm going to quickly say, it's simple enough. There are 2 experts in the room. It's you and the patient. You have an expertise in COVID vaccine, perhaps, medications, healthcare. The patient has an expertise in what? I saw people mouthing it, in themselves, in their lives, their health, their own personal health. We don't want to lose sight of that. We don't want to discount that. So together, that is the partnership. We are here together. And on the right side of the screen, what you can see are some things that we might say to reinforce that. We're working on this together, right? So partnership, we're not going to spend a lot of time there. We'll leave it at that. Acceptance. Acceptance is likely at this critical time with vaccine hesitancy, one of the most important things we can do. Acceptance is supporting the autonomy and patient choice. And I know that is so hard, especially for folks who are driven by public health and public health wellness and population health. But what this looks like is, at the end of the day, the choice is yours. You're in the driver's seat. You know, we can sit here and have a dialogue about getting vaccinated, but I want you to always know that it's your choice. And I say that frequently to people because it is so common for folks to feel like they've lost their ability to make a choice in their own health and wellness and care. And maybe trauma has impacted that as well, their ability to have control over their world. And so it's really important that we embody acceptance. Compassion. I'm imagining that you all are quite compassionate people, but in the words of Carl Rogers, compassion really is sensing that person's inner world in front of you, but without ever losing the as if, right? It's not our life. We haven't lived it, but we can imagine that this decision, for whatever reason, is really hard. And these are some comments we can make that embody compassion. It feels like people aren't understanding your struggles. This has been really hard for you. This is a really difficult decision. Those can embody compassion. And then finally, evocation, that's it right there. That is drawing out their motivation. So again, there's no script for these conversations, but these are some questions or some statements that might draw that out for some folks. It may not for others. But you might ask, how do you see this pandemic ending? Now, again, you might want to be thoughtful with how you ask that or who you ask that to, but that will give you some information to help you understand how they see it ending. What are some health concerns that are important to you? And maybe there's a commonality there with getting vaccinated, and that's what we want to look for. I like this last one. If you have access to an EHR or you can see that they've been vaccinated with influenza, I see that you've gotten your flu shot. What motivated you to get that? And maybe, again, there'll be some commonality there, and we can pull from that and we can continue that dialogue. Okay, so that's the spirit. The spirit must be present for this to be MI and not manipulation, okay? Now the skills, that's the whole other aspect of this, is open questions, affirmations, reflections, summaries. We are not gonna go over all this. We're just gonna talk about reflections because that's the part that people really need the most practice with. I think we want to keep our questions open. Tell me more about what you know about the vaccine. Tell me your worries, tell me your fears. And then we're going to go into reflecting. So in an MI-based conversation, I ask open questions, they answer, I reflect. Okay, a reflection in its simplest way is my hypothesis as to what I think they're trying to tell me. Now hold on to that, because we're going to practice. So it's my hypothesis as to what I think that person is trying to tell me, but I don't just repeat it. So if Harry were to say, well, you know what, Kelly, yeah, I don't want to get vaccinated. And I repeated back, you don't want to get vaccinated. That's a simple reflection, but that's not going to get you any kind of dialogue. What I want to do is I want to go deeper. A reflection goes deeper and adds more meaning and moves that conversation forward. Okay, so here are some examples, but what I would like to do is I would like to get a dialogue going either verbally or in the chat, because I think this is where things are most valuable. So here are some examples of some things that I was hearing early on. I have this conversation pretty routinely with almost every patient I see. So I hear, I'm scared to get this vaccine. I don't want to get sick. So we addressed that earlier. A reflection I might give back to that person is, you really care about your health. You're really concerned about your health. That's what I hear when I see that, right? I don't want to look for what's false, but what I want to go deeper in is what is really going on with that individual. I don't trust anything from the government right now. I've certainly heard that a fair bit. So I might reflect with, you want to make sure that whatever you put into your body, it's safe. Or how about you've had some not so good things happen to you from your healthcare in the past or from the government, and that makes you fearful. That makes you want to make sure that this is not harmful for you. That's what I think this person's trying to tell me. Or I actually hear this a fair bit now. I don't really go out and see anyone, so I don't think I really need to get the vaccine. And so there's lots of ways to reflect that one as well. You might say something like, you think other people need to get it before you. You're not so sure that you're at risk right now. Yeah, I hear that one a lot. So if we could just for a minute, because I know we're getting close, we got about 5 minutes left. Does anyone want to throw out other things that they're hearing that we can do a little practice responding to? Are there other comments about getting vaccinated that folks feel stuck? when they hear it?
My job is forcing me to get a shot, and I don't feel that's right.
Oh, yes. It feels really scary to, or even it feels really wrong for someone to take control away from you. It can feel really vulnerable when that happens. And you know what? I'm not there to take a side either. I'm not there to say, right on, good for your work. Or, you know, to the contrary, I'm there to just take in what that person just said to me. And imagine again, when someone feels like their control is taken away from them, how that feels. Validating that and listening, right? Okay, that's a good one. What else do we hear?
Another one I hear is, well, I had COVID in the last few months, so now I'm protected.
Yeah, it feels like having the infection itself was enough, and you're not so sure that getting vaccinated adds more value. Could you tell me a little bit more about what you know about getting vaccinated? Or even could you tell me a little bit more about antibody development from getting COVID? And again, that allows me to know where is their knowledge really, right? And then I'm going to continue that conversation. I'm going to reflect on what they tell me, and I'm going to keep going. I want you to remember though, if my goal is for this conversation to always end with that person lining up to get vaccinated, I'm going to feel really upset. Okay, it's not going to go that way every time. But my hope is that every time I see that person, I maybe get a little bit further. I get them thinking a little bit more. They're going to go home and they're going to think about it a little bit more. Maybe they're going to get online and do a little searching. And that's it. It's just a little bit. And the reason that's so painful for folks, guys, is because when we are in a global pandemic, all we want to do is see change. And all we want to do is see healing. And we feel this time pressure. And that time pressure says, I don't have time to do this. You got to do it now. And so I'm here to tell you, with the folks that are still hesitant, we got to give space for them to be able to get there, right? And it's hard because we see people suffer because of it. That makes it hard. What else do we hear? Maybe just one more, if there's a common one that you hear that you're not sure how to respond to.
Even people who have had the vaccine are now getting COVID.
Oh yes, even people who got vaccinated got COVID. And so I'm imagining what they're saying to me is, why bother? Why do I need to bother? You're wondering if it really even matters. Does it really even matter if I get vaccinated, because people get it anyway? And then again, I'm going to reflect that, and I'm going to go right into, tell me a little bit more about what you think the vaccine might offer for you. Do you think there's value in it? Tell me more. And you know what? I bet you that a lot of folks would be able to tell you, well, I think it might protect me from going to the hospital. Let's talk about that. All right, that's where I want to go with it. And I don't need to be the one to tell them that. Guess what? They read. I'm assuming they've seen that, right? And so I want to get that pulled from them. That's a good one. So this is what we were doing earlier on. We're still calling folks, but I think for me, most of my conversations are when I have someone on the phone or in front of me, I'm going to say, either have you thought about getting vaccinated, or tell me how you're sitting with the vaccine at this point. And you might a fair bit still get, absolutely not going to happen. I don't want to talk about it anymore. And so I think it's important to be prepared for that. And again, y'all have probably already had a lot of these dialogues. I'm going to do the same thing. I'm going to say, it sounds like you've got some frustrations about this. It sounds like people have probably been pushing you a lot. I don't want to be that person to push you either. I would love to engage you in a conversation about this when you're ready. Know that I'm here to listen. I'm here without judgment to answer your questions, because in the end, it's your choice. It's always your choice. And that's where I'm going to go with that. And I'd love to kind of end it with, would it be okay if I share this information with you, or if I give you this, website to check out? They can take that and they can do what they want with it. Hopefully a little bit goes a little ways. And so I guess the last piece I'll say, and I hope this is also in your thoughts, is that it is absolutely understandable why people would have a distrust in our healthcare system. And I think it's really important that we acknowledge that. And especially in minoritized groups, folks have struggled to get equitable care for a very long time. And so it's understandable why folks would be hesitant or feel like things were not in their best interest. And so with that, if we're building trust, I think it's important that we validate your experience has not been what you hoped it would be. It's been scary. For a lot of the folks that I see, their hospitalization experiences are quite traumatic. Validating that, discussing it, and then here's the part I really want you to hear or see, is to listen to understand, not to respond. I just am here to listen. Even if I just have a minute, I'm here to listen, to really understand your perspective, not because I need to get my last comment in. And then finally, this is it, ultimately respecting autonomy. So the big takeaway is there is a place for you to bring out your information, and it goes like this. I ask, offer, ask. So ask, can you tell me a little bit about how you're feeling about getting vaccinated? We have a dialogue, and then I get to a place where I offer. And what that looks like is, would it be okay if I share with you a little bit of information that I know? And I ask permission first, right? I want to ask first, and they can say, nope, I'm good. I know all I need to know. Or they might say, all right, go ahead, give me your information. And then I circle back and say, how do you feel about that? And that's the ask, offer, ask that we're looking for. It doesn't take that long, just a minute or less. So as we wrap this up, I think we highlighted, try to put yourself into that guide place if you can. And acceptance is, of course, this place where we say, ultimately, this decision is yours. And I will leave you with this quote that really resonated with me as I read it the other day. We think we listen, but very rarely do we listen with real understanding and true empathy. Yet listening of this very special kind is one of the most potent forces for change that I know. And I think just let that sit with you as you imagine how to move forward in these conversations. I know they're not easy. And I would also say to be kind to yourself, because you are out there working so hard. And I know that it feels frustrating and you feel defeated and exhausted at times. So taking care of yourself as well. So with that, I know we're at the end of our 30 minutes. I don't know if we want to have a little bit more dialogue or if folks want to share some of their experiences or concerns. You're welcome. I'm reading the chat.
Our lifespan.
What was that?
Sorry, that was me hitting the wrong button on my screen here. So yeah, I was gonna say, we can definitely open it up for questions and any issues that people want to discuss amongst the group.
And it's okay if folks also say, you know what, Kelly, this is not, I just can't see this for myself. And that is okay to share that too. I think, you know, these conversations are not easy. And it's important to be honest with ourselves. And yeah, I'm looking in the chat. I'd love to hear more thoughts.
Thank you, Kelly, for the information. I had a question. Sorry. Go ahead.
No, go. No, go ahead. Go ahead. I was just gonna, praise Kelly. So.
All right. Thank you very much for the information, Kelly. I mean, I have a question. My staff, I have 2 staff that is adamant they don't want to take the vaccine, but they want to take COVID test every week. And, they know everything. I've given them the literature, but it's just, my dad says this and my mom says this and my friends say this. That's what I keep hearing. And it's they have all given me an answer. They'll take COVID test every Monday, no problem. They don't want to take the shot. And I've not been able to shift their thought process.
Yeah, I think there's still space for even five-minute dialogue each time you have that conversation, and ensuring in a place of non-judgment, trying to understand a little bit more why they have that belief system and what brought them to that place. Sometimes you might be quite surprised where that comes from. I think for a lot of the patients I see, it comes from true experience of trauma. true experience of trauma has led them to this place to say, and maybe they're not okay to share that, but it's led them to this place of absolutely not. I am not going to let somebody inject something into me. And so I think whatever that is for that person, it's probably deep at this point, and it's probably hard to share. And so giving the grace of that, but also continuing to engage as best you can. And again, being okay at the end of the day, it's okay. You're gonna get tested every week. That's your choice, right? And sitting okay on that too. The other piece I'll say to this is, and I, in particular with family and friends and close colleagues, this feels very personal. MI sometimes goes out the window whenever things are personal, because we have a vested interest in that person's outcome and health. So I want you to know that it is not uncommon for us to unnaturally move into a director role. We don't necessarily intend to, but we move there. And I'll tell you, I do that myself with my own family, and I have to stop myself and say, okay, this is not productive. But we go there because it's coming from emotion. And so thinking about that too, and letting yourself step back. If you can't engage in that conversation with a family member, step away, because it's not healthy for either of us. But it can be more challenging. So I wanted to put that out there. If it's a close colleague that you, and patients too, but in particular with family and friends, it can get tricky. And so knowing when to step back and take care of yourself is important. Yeah, I see some comments. And
Kelly, to follow up on that, from a manager kind of ownership role, I know that a lot of owners kind of take a paternalistic, maternalistic perspective when it comes to their staff. Is there certain kind of techniques, or even just kind of being able to listen to people in that, you know, kind of flies in the face of what we experience with vaccines in that? How do you kind of engage colleagues in that sense?
Well, I would say the same thing to you that I would say in general in the context of MI, which is we're not the parent to our patients. That's commonly what we say. And I'd say the same thing. You're not the parent to, people that you work with or people that work for you. And I think when we fall into that role, and people who are parents in this room, or even dialogue you have with your own parents, you can see how it can be unhealthy. And you can see how when we move into that place of directing, it's often ineffective. And so the piece of advice I guess I would give is to really step back from that. And is it possible to engage folks that work with you in a bit of a different way? And I know that you got to find the balance, because there's places where being a director is an important part of the job. But when it comes to one's autonomy and making a decision for their health and wellness, are we allowed to kind of step back and honor that? So these are not easy. If they were easy, we wouldn't be here talking about it at this point in the pandemic, right? And I think time, I guess the other piece I would say is for folks who really embody MI, you get that these conversations take a very long time for a lot of folks, especially at this point. So if I expect change to happen tomorrow, I'm going to feel really disappointed. But understanding that this is a process, change is a process. And if you want context, think about it from an addiction perspective. We recognize that addiction can run deep in someone's life for the majority of some folks' lives, and change is not easy for folks. And so that's something to really think about. If change were easy, folks would be, rocking their health all the time. Yeah, appreciate that comment. A reminder on empathy, and a reminder too for self-compassion. We exude empathy, or we want to embody empathy for everyone that we work with, but also taking care of yourself, because it's exhausting. I'm imagining all of us are exhausted at this point in the pandemic, and so making sure that you are taking time to take care of yourself. Yeah, you learned that it takes 3 to 5 combos to gain. Yes, absolutely, and sometimes longer for sure to gain trust. Thank you for that.
Kelly, it looks like Abby has her hand up.
Oh, sorry, Abby.
Hi, thank you so much. This is very timely, Kelly. I'm curious, actually, from the state of Illinois, if you think we should target certain geographic locations, certain high-risk population, and certain perhaps, numbers that we're not seeing improving. I don't want us to think, if we improve one county or, one area of Illinois, everywhere is going to be fine. But I do think that we may have to target the high risk population first. And what some of the lessons that we can implement that we can achieve the numbers that we'd like to achieve. I'm recalling we've had other breakouts, like say the measles breakout, and everybody stepped up to the plate. And we've actually were able to, face that challenge, and we didn't have that anymore. Kind of curious what's about COVID-19 that created that resistance to the vaccination.
Mm-hmm. I'm sure there are folks in this space that have better thoughts on this than I. I mean, I'm happy to share my own reflection on, in particular, underserved communities. I do think that we need to have a bigger reach, and I think we need to have access to care, not just about vaccines. Part of the issue is if we focus just on getting vaccinated and we lose sight of everything else. The idea is that people should trust that they have a clinic that they can go to and they can get care and preventative care ongoing. And so if someone comes in and drops in COVID vaccines at a gym for a weekend, is that really sending a message that I care about your health beyond this? That's what I would love to see in rural communities and in urban underserved communities, that people have true access to care well beyond this. But there's lots more that I'm sure folks could add. I don't know if Garth, you want to chime in and add your thoughts.
Yes, and it's, as Kelly was saying, we have to be very aware of, the impact on various communities and what they've experienced. And plus, we have to realize that vaccine hesitancy isn't a new thing. I probably should have grabbed a graphic of it tonight, but I actually just purchased a couple of weeks ago from an antiques dealer a smallpox certificate from 1903 from New York City. And there was an article that Time had just recently done talking about vaccine hesitancy campaigns or anti-vax campaigns going all the way back into the late 1890s. So, this isn't a new thing. It's just social media has allowed this to become an explosion of an exponential proportions. One of the things that I'll talk about whenever I switch to my slide deck, but remember we have the documentary that you can share or host screenings or have it playing in your pharmacy. It's Vaccination Against the Misinformation Virus, that NASPA and IPHA Foundation were supporters on helping get it produced. And it helps address a lot of the issues that Kelly talked about. And is it going to be, you're going to sit somebody down in front of it and they're going to magically change their mind? No, but it can help provide some quality, perspective on a lot of their concerns, and show them where they've been kind of manipulated also by social media and other things. So it's we'll be sharing that link in the chat. And for those that missed our showing that we did with IPHA Foundation last week, we're still waiting on the recording to be finalized, but that's only a 30-minute segment. But it did have an interview with some of the people that were part of the documentary, but the full documentary is 1 hour, and I'll put that link in the chat here in a minute.
Well, great dialogue, folks. I really appreciate spending tonight with you, and wish you positive energy as you continue these difficult conversations.
All right. Let me pause the recording here. All right. We'll switch over here. Kelly, anything else that you would like to cover? Good. If not, we'll go ahead and proceed with our slides here.
I don't think so. I'm
Oh.
available. My email is here if anybody wants to email me with questions or references, things like that.
Well, I greatly appreciate you being able to help us, and I know we gave you a little short notice on being able to help us, so we greatly appreciate you pinch hitting for us. So thank you, and very timely. As stated, we have the available documentary that you can use, Vaccination from the Misinformation Virus. And as we talked about during the session, the live screening of it this was not made with COVID in mind. COVID happened as this documentary was being produced. And so COVID kind of got added into it, but it was not its original goal. The original goal was to be addressing all of vaccine hesitancy in general and addressing all these issues, because it's not just COVID vaccine specific. So I do highly encourage you to take a look at it, take some time. We got some great feedback from a lot of the people that attended the national screening. And so please do take a couple of minutes to take a look at that. I'm just putting these stats up here as we've done every month. As we all know, cases continue to rise. Every county, depending on which day you look at it, is increasing with the number of cases. But most particularly, what's been getting a lot of focus is that we are in a significant low proportion of our available ICU beds. And we really need to be taking a look at that, especially in the southern part of the state. I know the southeast part of the state, I believe, when I looked at this earlier today, only has 6 ICU beds for 20 counties. That's a crisis. And I know a lot of people think, well, we'll just send them to Kentucky or Evansville, or Indiana or Kentucky. Well, they're just in a worse situation as we are. So we have to do everything we can and keep battling again on this. Since we last got together, IDPH has put together a web portal that does allow you to access your eye care record. This is not perfect yet. I actually logged into it, was actually able to get everything going back to 1977. It only had a missing of a couple of flu shots in the mid-90s, but everything else was pretty much correct. But I know we've had people, even on staff, go in and nothing shows up at all. So it's not perfect for everyone. So we're still trying to figure out what the best process is to help with public health, of trying to figure out for those individuals whose records aren't appropriately connected, because it's using some of your credit history as a security protocol of linking you to the right profile. So there will be ways to fix it. It's just, this is brand new, and it, of course, we had to push it forward before I think it was ready to go. As we've looked, we've got 59, just shy of 60% of the state, the 12 plus, that has been vaccinated. And so we're making headway. We're definitely over halfway there, but as we all know, we need to be getting closer to 80% plus before we can hopefully start seeing herd immunity definitely taking a good hold. I know a lot of questions come up, well, about breakthrough vaccine cases. Well, here's the actual numbers. The number, we're talking 0.02% of those fully vaccinated have been hospitalized, and 0.004% may have passed away. But again, that doesn't mean they die due to COVID or other complications. And so, again, more data to kind of have those open discussions with. Just a reminder, we did update their COVID-19 vaccine resource guide with some the additional information on the boosters. Please do continue to help get your patients who are immunocompromised, and there have to be moderately or severely immunocompromised. And the CDC has spelled that out. We've put links to that in the vaccine resource guide, so please do take a look at that. Also, excuse me, with the Pfizer vaccine being approved, you do need now, for at least those 16 and over, you do need to if you start to receive the branded product, I don't believe it has started shipping yet, but once you do receive the branded product, you do need to start shifting over to using additional handouts besides the EUA handouts. And I know eventually ACIP will be having a VIS coming out. So you have to remember, as we start to transition this from an EUA to approved products, normal rules apply. So just to start thinking about that in the back of your mind. As we all know, last Thursday, the governor did issue Executive Order 2021-20, which does mandate that healthcare workers in healthcare facilities, or those that work in healthcare facilities, have to be immunized, or they have to adhere to weekly testing measures. And that does start on September 5th. That is a very quick turnaround because there's still a lot of questions. There is still supposed to be an FAQ document coming from the governor's office. We were told early in the week. It's now midweek. We still haven't seen it or a draft. I know one of the things in that is going to be a statement clarifying that pharmacists and pharmacies and pharmacy personnel are covered under this proclamation. And additional questions I'm sure that will be addressed as well. IPHA, along with ICHP and the Illinois Association of Long-Term Care Pharmacy Providers, on Friday, we issued a joint statement supporting the executive order and expecting pharmacists to please step up and do the right thing of getting vaccinated. I didn't think we'd have to get to the point of supporting an executive order because we should be supporting, positive movement and being examples, but we're kind of push comes to shove a little bit. So we also know that these statements also help provide support for owners and those that may be supervisors to be able to help having those harder discussions that you may be having right now with your employees. So we're glad to be able to help provide that additional support for you. You may not have seen it, but earlier today, mid-afternoon, APHA, ASHP, and the AMA issued a joint statement calling for an immediate end to the improper prescribing and dispensing of use of ivermectin. We know that this has continued to be a major issue. We know that we've seen like a 4 or 5-fold increase in requests nationwide. And the CDC and the FDA both have come out with advisories against this. And that's one thing that we need to keep in our mind now that those two entities have come out with advisories against. It makes it harder for evidence for people to say they should use it for off-label usage because the FDA has considered that there's not enough evidence to justify those judgment calls. So please do consider that as you continue to have those hard discussions with situations with patients that may be coming forward wishing to improperly use ivermectin. Today, we are announcing that the 2021 edition of the Illinois Pharmacy Laws and Regulations is officially available from LexisNexis. It has been since 2010, since we had a previous edition. We're glad to work with LexisNexis again on a brand new version of this edition, which is close to just shy of 1,200 pages of information that's a lot easier to utilize than it is trying to find it on the Illinois General Assembly website. It is $55 and it comes both as a softbound book and as an ebook. The ebook version, for some reason, the links aren't working on their website, and I'm hoping to have it fixed by Friday. But the ebook version will be available. And you'll see here that starting today through the end of the month, you will be able to save 30% off of the book, and so it'll be $38.50, but also shipping. And shipping is a little pricey, so it brings it back up to about $50. But after that, the end of the year, if you decide not to take advantage of ordering it this month, starting American Pharmacist Month at the end of the year, it'll be 20% off. So our plans are to continue to have this as an annual renewed publication. In addition to adding additional content. I've already looked at probably another couple hundred pages of information just on an Illinois level of making sure we have information in here. The only federal information that's actually in here, because LexisNexis has permission, there is the new version that came out in late October last year. So you may not even be aware of it, but the DEA did issue a new version of the Pharmacist manual. So do take advantage of that. Lastly, we are still planning to be in person October 24th through the 21st in St. Louis at the Hilton at the ballpark. Early bird registration did end yesterday, but please do consider signing up and registering. We do have a full agenda of great speakers coming in and exhibitors who want to see you in person. We will be shipping out a statement tomorrow that we'll be talking about that we will be requiring masks at all events during the conference. The expectation is that you're vaccinated. We're still discussing about documentation on that. And we expect if you are not vaccinated that you will need to provide proof of a negative test with 72 hours prior. Within 72 hours prior. We're still looking at whether we're going to be offering, there may still be a possibility of on-site testing for those that want to give some students some opportunities to practice on their nasal swabs. But we want to make sure that we are producing our continued quality event, but in a safe manner. I appreciate those of you who have already registered. We're actually well ahead of our usual registration numbers at this point. But we do want to encourage everyone to continue to please support the association in this and do come and network and be together with everyone again in person. In addition, one of the measures that we're going to do to help with not only keeping everybody safe, but just to help as people start to acclimatize, a lack of a better phrase, of being amongst people again, is that we will be using a wristband color code. If you decide that you want to just be socially distanced, you'll be wearing a red wristband. If you are okay with just doing elbow bumps with people, that'll be a yellow wristband. And if you are all for the hugs and handshakes, there will be a green wristband. And so that will help with attendees that will be able to identify and respect your personal decisions as we are all together during the conference. But I did want to kind of go through that. Laura, I figured you'd have like that wristband idea. I actually thought of you when we were looking at Wisconsin had developed this very similar process, and they said handshakes and hugs, and that's immediately what I thought about. And so I'm really glad that we're trying to work around this process. And please encourage your peers. I know it's very difficult, to take a look at these situations when we're continuing to battle this virus. But I'm going to be honest with you, it's going to be a financial negative hit hard to the association if this conference doesn't go off. And so that means people need to stay in the hotel, and we need to get enough people there. I'm just being flat out honest about it. But that doesn't mean that we're not using that as an excuse not to think about safety. We had a very lively discussion with our Missouri counterparts today, trying to help hammer out some of these safety issues. And this is where we keep coming back to, is that we want to be together, but we have to be safe doing it. And so we're doing everything we can to make sure that happens. So I really encourage everyone to come. Any questions or comments for the good of the order? We've had a very lively discussion tonight, and I appreciate so many of you joining us tonight.
Hey, Garth. Quick question regarding the law manual. Do we know when the next version of the Pharmacy Practice Act will be going through? A little hesitant to buy a book and then have like especially if it's published on an annual basis, and then the Practice Act is updated, and suddenly your book is out of date?
Well, the Practice Act is always being updated. So everything was up to date in that book up until the end of session this year. So we probably won't be issuing another one till the end of session the following year, which will include a lot of the changes that have happened since June. So, changes in the immunization language, that the technician training is pushed off for 2 years, the contraceptive language. It's even though we've got shorter windows now that we can put this in, we're just not that short yet because of their drafting and proofing guidelines that they have to have with their editors. We're not able to keep it that fluid. That'll be great if we can get to that point, but we're not there just yet. But we're really glad the way that they've been able to keep this down, work with this new version, even as large as it is. It's significantly cheaper than what it was the last time around. It was, I think, close to $100 or $85 the last time we offered the book as full price. So $55 is definitely a lot easier and a lot less frustrating if you've ever tried to go through and try to find some of this stuff on the website. So, this could be something that, if you don't need to buy it every year, I'd buy it at least every couple of years. No, don't let it go past that. Just so that you can make sure that you're keeping everything as close to up to date for yourselves. And the one thing that we're working on with them as we go forward is having some type of highlighted section at the beginning that kind of talks about the changes, or at least the majority of the highlights of changes from the previous edition. Some of the big things. There were just so many changes from when we did the 2010 edition that would almost be a chapter by
separate
itself.
volume.
Yeah, exactly. But this new version includes not just the Pharmacy Practice Act and the Controlled Substance Act and the rules like we've always had before, but it also includes a significant amount of the long-term care code for those that work in long-term care and consulting, a significant portion of the insurance code that applies to PBMs and to us, and a good portion of the Medicaid code is in there as well, and also the core provider acts, the practice acts of all the other prescribing healthcare providers, so that you at least have some additional reference for that as well. And so we really wanted to make sure you have a lot more information at your fingertips or your swipe of a finger, depending on which version of the book that you use. Good question, Sam.
And you mentioned oh, go on, Harry.
No, go ahead, Sam.
Oh, I was just gonna clarify. We did mention at the last meeting that the rules would be following the statute, so it'd be easier to reference between the two.
Yes, that's correct. Actually, let me share my screen again here real quick, since I actually have this part of the book separated. So you'll actually see the table of contents here. We have the Pharmacy Practice Act and the rules. For those that may have used the older edition, all the acts were listed separately by numerical order, and then all the rules were listed separately by numerical citations. So we put everything into categories and grouped it together. It's something that we worked and pushed real hard with their editors to say that we needed to make sure that this was more usable. And so the only thing this doesn't have compared to our previous editions, this doesn't have any of the index thumb markings. Lexis doesn't offer that for their publications anymore. But we did want to make sure that these were better categories and grouped together so you can find things a lot easier. Harry, you had a question?
Yeah, I was going to ask regarding the Pharmacy Practice Act. Is there any movement as far as the next generation of the act now that we're kind of over the hump from the Chicago Tribune debacle?
We are, but a lot of those discussions are probably going to be, I would almost say 2023 as we start to look at the next renewal cycle. A lot of the discussion and focus right now is on preservation of a lot of the PrEP Act HHS expansions. But there is discussion about we really need to modernize parts of the act. And so a lot of our push also right now is with the department and trying to get them to finally issue and update some of the rules, because some of the rules need to be issued on lunches and breaks, additional rules on technician immunizations. Actually, we need to go back to 2015 and put in rules on interchangeables and biosimilars from that language that got passed back then. The department is that far behind in issuing updates on the rules. So there's a lot that needs to be addressed. But no, we're going to keep pushing on it. That doesn't mean that we can't keep enhancing parts of the act in the meantime, like we have with the contraception and provider status expansion.
So then in that case, we should be looking at 2023 to really hammer things out. So right now we don't necessarily need to do anything other than updates.
Right. Everything is just going to be updates at this point, at least unless things really start to clear up policy wise. Everything is more of a cleanup from COVID, but things are still very fluid with COVID. So a lot of that is going to be the continued focus right now. Good question. Yes, Rupesh.
Guys, with this COVID testing for our staff and stuff like that, what is our responsibility for documentation and how we have to keep a track of that with they're being tested every week?
That has not been issued. That type of guidance has not been released by the governor's office in their FAQ, but it is a question that has been asked of how is all these entities supposed to be keeping documentation? What's the documentation requirements? Plus, I hope that they put in there, because we've asked for it, and I know Illinois Retail Merchants has asked for it too, is clarifying that it is the employee's responsibility to pay for their own tests. This is not an employer's responsibility, because this is a personal decision, and therefore it's a personal out-of-pocket expense for them.
Thank you.
No problem. Any other questions?
As far as the safety issue for the conference, you said you're coming up with a statement for what we would be looking for annual for the Illinois side. Is Missouri doing the same thing?
It's going to be a joint statement.
Okay.
So I'll be applying to both of them.
Cool.
Yeah, no problem. I know where you're going. No problem. All right, everyone. Please keep in touch with any questions as we go through. I know we've got probably expansion of booster doses as we go forward. We know the White House has said they want everybody to be able to get third dose boosters starting on the 20th. But ACIP was pretty clear in their meeting on Monday that they want to pump the brakes on that. They want to make it a little bit more prioritized. So we may be seeing the reinitiation of some of the phases that we had the first time round. There was already discussion that the first round should probably be healthcare workers and those over 65. So we'll just have to keep an eye out as ACIP and the FDA continue to have those discussions with the administration. And but if you haven't, please do consider to register for a conference, and we'll see everyone in American Pharmacist Month in October. Have a great evening, everyone.
Thank you. Good night.